Okay, so thank you so much for your hospitality, Travis. And you and your team are great, and I really appreciate sharing with your followers and viewers. And basically, we've got to talk, because of all these vaccinations coming, we've got to talk about the COVID. And it's been a terrible failure, the approach to COVID, because doing the best that they could do with all the masks and hand sanitizers and distancing and all that kind of stuff, there's, let's see here, 14.7 million infections in the United States alone and 300,000 deaths. That's not a very good record, okay? And that's because they only did one piece. They only did 10% what they needed to do. It's not like this stuff is unknown. The 10% they did was distancing, wash your hands, use the hand sanitizer, use our colloidal silver. Let's see here. Also, you need to wear a mask, do all that stuff, and it will reduce the contact stuff, okay? It'll reduce the possibility of contact. But that's it. It didn't do anything to help the patient. Now, they knew in the beginning that it was going to be a year and a half, 2 years, and it's going to be closer to 2.5 years before vaccines, the ultimate vaccine for this, is available. Okay. And so because they didn't do the other pieces, which we're going to talk about today, 14.7 million infections and 300,000 deaths in the United States. Terrible, 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 terrible record. It's just a mess. So what's going on here? Well, let's look at a couple of things first. Let's look at, let's see here. Let's look at obstetricians, baby delivering doctors, and gynecologists, doctors that deal with women's health issues. They live to be 76 as of last week, according to Center for Disease Control, CDC. Their average lifespan is 76. Medical doctors went to the same medical schools they did, who are emergency room physicians, and trauma doctors, their average lifespan, according to CDC last week, was 57. You lose 20 years of life if you become a trauma doctor compared to a baby, get a woman pregnant doctor or deliver a baby doctor, okay? So why is it? Well, here's why. The people who make prenatal vitamins for babies give samples to the obstetricians, okay, and gynecologists to give their patients, but they don't give them to their patients. They take them themselves. They're taking the prenatal vitamins. By contrast, the doctors who are trauma doctors, emergency room doctors, they get off at 2 o'clock in the morning. They stop, an all-night, one of these waffle houses or something like that to get some pancakes and waffles and stuff. Then they go home, have a couple of shots of whiskey or a couple of beers before they go to bed. All gluten. Their intestines are dead. They cannot absorb nutrients even if they're supplementing. Okay, now let's look at some more evidence. When 3-year-olds get COVID, they get they can't even call it a fever. Their temperature goes up 0.5 degree, so you can't even call it a fever. My temperature goes up 2 degrees when I exercise, right? So we're talking about they don't have really a fever. Their temperature goes up a little bit, 0.5 degree for 3 days. They had common cold-like symptoms for 3 days. Only one kid under the age of 10 has died here in America from COVID. Only one. They're not getting any special treatment or vaccinations. And after 3, 4, 5 days, it's over with. Done. They got their antibodies. Boy, they're good to go for the rest of their life from COVID. When a 63-year-old or 73-year-old or an 83-year-old gets COVID, they're in trouble. They get 103, 105 fever. They got to, either stay at home or go to an emergency, and they're on ventilators for a month or 2 or 3. They have terrible complications, some of which remain with them after they get out of the hospital or they die. So what's the difference between a 3-year-old, a 63-year-old, a 73-year-old, and an 83-year-old? Well, a 3-year-old's only been eating gluten for 2.5 to 3 years. Everybody else is eating gluten for the length of their life, 63 years, 73 years, 83 years. And their villi in their intestines have shrunk and gone. And so now instead of looking like a shag rug, their intestines look like a plastic tube. They've lost 95% of their absorptive surface. Even if they can digest, they can't absorb anything because their intestines are dead. And they cannot make, when your villi are dead and you're eating gluten, you're not absorbing nutrients, even if you supplement, because you lost 95, 98% of your absorptive surface. And so you cannot make white blood cells like T lymphocytes, which go through the bloodstream to kill and eat the viruses. You cannot make antibodies from your stem cells in your bone marrow. Okay. You cannot make red blood cells or platelets. And so you have a lot of bleeding on your skin. And most people who die from COVID do not die from viral respiratory infections in their lungs. They die from hemorrhaging because they can't make platelets and red blood cells. Now, Travis, you know of people, or you've heard of people, you know, particularly people who are like 35, 40 years and older, who will have to go to the doctor once a month to get a B12 shot and an iron shot because they're constantly critically anemic. And some of them have to have also a transfusion every month because they have low platelets and low white blood cells as well. What's going on there? Well, their bone marrow is dead because they can't absorb nutrients for the stem cells in the bone marrow to make all this stuff. Red blood cells, white blood cells, platelets, and antibodies. And so they get what's called a dysplasia. Their bone marrow goes from being a beautiful organ that makes red blood cells, white blood cells, platelets, and antibodies. It goes to making nothing. It just has scar tissue and fat. That's why they have to go in for the iron shot and the B12 shot and get the transfusions once a month or two so they can have platelets and red blood cells, stop hemorrhaging under the skin, all kind of stuff. So this is not a mystery. Doctors have been treating people with these issues for 100 years. So why is it that they left that piece out? Wearing a mask doesn't deal with that. Wearing a mask doesn't help you with your intestines. Distancing doesn't help you with your intestines. Okay? And so I'm going to give you a couple of statistics that's going to blow your mind. Let's look at the state of Florida, which has 21 million people, and compare it with Australia, which is a country which has 25 million people. It has 4 more million people than Florida. Australia has 908 infections, that's of today's numbers, 908 infections in Australia, 27,944 infections. Florida, with 4 million less people, has 19,236 infections and 1 million infections and 19,000 deaths. Now, is 19,000 deaths more than 900 deaths? Yeah, 19 times.
That's quite a bit.
Yeah, 20 times almost, okay?
Wow.
And same thing with the infections. Let's see, so gosh, you're looking at 100 times more infections in Florida than Australia. That's because Australia is like 30% the sort of their equivalent to the Native Americans, okay, with their what do they call it? People, okay? They're indigenous peoples. And they live on corn and rice and sweet potatoes and things like that. They even have a rice beer that they use. Whereas Florida is 31% Latinos, everywhere from Cuba and Mexico. And they live on everything wheat, barley, rye, and oats. Their intestines are dead. They don't supplement. Bad combination. Okay, now you know that basic stuff. Let's look at a couple more things here. Let's look at Ireland and Singapore. Both of them have 6 million people. Singapore has 29 deaths, and Ireland has 2,000 deaths. 29 deaths versus 2,000 deaths. Singapore has 58,000 infections, and Ireland has 75,000 infections. Okay, about 50% more. Let's look at England, the UK versus Thailand. Both of them have 67 million people. Thailand has 60 deaths and 4,000 infections. England, UK has 61,000 deaths and 1.7 million infections. Let's look at Texas versus Taiwan. Both of them have 25 million people. Taiwan has 7 deaths and 690 infections. Texas has 22,594 deaths and 1.25 million infections. So why do they have the same population? So why does Texas have a 1.25 million infections and Thailand only has 690? Why do they have essentially 23,000 deaths and Taiwan only has 7 deaths? Well, that's because Taiwan is an Asian country, kind of like Thailand, and they live on rice and sweet potatoes and vegetables. And Texas, the average is almost 39, almost 40% Latino. There's some counties that have almost 100% Latino. All they do is live on wheat, bran, and oats. That's all they drink is wheat, bran, and oats. Okay, a couple more, then we'll get to the punchline. Let's compare Mexico with Japan. Okay. Another Asian country with a Latino country. They both have 127 million people. Mexico and Japan. Mexico and Japan both have 127 million people. Japan has 2,300 deaths. Mexico has 109,000 deaths. Okay, 50 times more. Japan has 162,000 infections, and Mexico has 1.2 million infections. Because Mexico lives on wheat, butter, and oats, and Japan lives on rice and sweet potatoes. Okay, here's a weird one. Let's look at India. India is the same size country as Japan, or China, same size country as China. 1.4 million people. Both of them have 1.4 million people. China is just slightly larger. India has 140,000 deaths. China has 5,000 deaths. 5,000 versus 140,000. India has 9.5 million infections, and China has 91,000 infections. What's going on here? Well, I spent 3 weeks with the CDC online going through all their data in the World Health Organization, recent as of like last week. It turns out that India has 29 states and 7 territories. The northern 9 states have 95% of the deaths and 86% of the infections. The southern 20 states and 7 territories have 5% of the deaths and 14% of the infections. So what's the difference? They're all the same people, very homogenous. It's not like they're half Africans and no, they're all Indians. They're all the same religion, all the same people. It's very, very homogenous. So what's the difference? So I asked him, I said, we need to see these people's agriculture. We need to see what they're eating. I said, do they all eat the same thing? No. The people in the top 9 states, which have 95% of the deaths and 86% of the infections, live on wheat, brown, and oats because they live in the mountains. They can't grow rice. But in the southern 2/3 of the population, the 20 states and 7 territories live on rice and sweet potatoes because they live in the swamps and the rainforest where they can grow rice. So they don't have a gluten problem. They still have villi in the southern 2/3 of India. They don't have any villi in the northern 1/3 of India because they're living on wheat in the northern 1/3. Got it? This is universal all over the world, no matter which Asian country you pick compared to somebody else that eats differently than them. It doesn't matter whether they supplement or not because their villi are gone, and it's like crazy. So what they should have done a year and a half ago, it'll be coming on 2 years here pretty quick. In addition to wearing the mask and using the hand sanitizer and that sort of stuff, right? distancing, 6 feet away, all wearing the mask. In addition to all that, they should have been getting everybody off of gluten and getting them on the 90 essential nutrients. We'd have had, in America, we would have had 10 deaths instead of 300,000. We'd have maybe 500 infections instead of 14.7 million. We wouldn't have this catastrophic financial issue going on because of all the shutdowns. In fact, they're hitting the shutdowns again because it's spiking terribly because if everybody got together, for Thanksgiving. There's going to be another spike after Christmas. There's going to be another spike after New Year's. And so the numbers are going to be horrible because the government still has not told people to get off of gluten and take the 90 essential nutrients.